Okay, so welcome everybody. Thanks for joining us this afternoon. My name's Eric Johnson, and I am one of the Associate Deans for Equity and Inclusion in the College of Education. And on behalf of the College of Education Equity and Inclusion Committee, I'm happy to welcome you to tonight's critical conversation about equity and inclusion. I also see one of our other members of the College of Ed Equity and Inclusion Committee, Katie Peets, is here too. So really happy to see you, Katie. And tonight we are going to have a great conversation. So I don't know if anybody has attended these in the past. This is our second year doing these conversations, and we really try to make them a conversation instead of a lecture. And so we encourage participation and questions and engagement. And you can see this is our fourth one this year. And they've been great. I will post a link in the chat after I unshare the screen to the other critical conversations in case you're interested. And so I'm really happy to hand it off to Kasee Hildenbrand. And I'm excited for this particular presentation. It's near and dear to the work that I do. And so I'm excited to see everything she has to present. So welcome. And with that, Kasee, I will stop sharing, maybe, or oh, not sure if you can see it. Those are the other four that we were doing, but not sure if I can share because it says reclaim host. And so I'll reclaim just so you can see the other presentations and then stop sharing. So Kasee, you can go ahead and take it away.
Okay. Well, everybody on this phone call is either a student or a colleague of mine. So thanks for being
Which is
here.
awesome.
It makes it way less, nerve-wracking to have to give this presentation. Nice work. If you can have your camera on, that always makes it better so that I don't feel like I'm talking into weird Zoom land.
Oh, you're way nicer than I am. I make them put their camera on, but
Well, I knew
it's
there were
not
a
a
couple.
class though.
Yeah, there were a couple
Yeah,
that are, I think, doing some stuff.
right.
So, um, although I think we just had one person join who's not part of the AT program. So I will try to make sure that this is applicable. So I will share my screen. All right. Okay. So those of you that have had class with me, this is somewhat similar to kind of what we've done before, but this was actually originally a presentation that I gave at the WSATA meeting, which is the Washington State Athletic Trainers meeting last July. That was in Puyallup. And it came about because in Washington State, if you are a healthcare provider, you have to have 2 units of continuing education related to DIA type topics in order to maintain your licensure status within the state of Washington. So this presentation was created to fulfill that need for licensed athletic trainers within the state. So you guys at some point will need it once you actually have your certification number, which you guys are close to getting. Okay, well, I'll jump in. There's some lecture part, and then we will do a simulation at some point and then have some reflection questions based off of that. I don't have any conflicts to report in this presentation. So again, these are pulled directly from the Department of Health as far as the standards that legislator passed. I think it was 2 or 3 years ago now that it was passed, and it was added to every healthcare profession that is overseen by the Department of Health. So there's 4 of them. It kind of focuses on the idea of implicit bias. And so for those of you, most of you that are on the call, you've heard about the Harvard implicit bias tests that you can take. I highly encourage taking those just so that we are aware of what those look like. Development of individual and system level interventions and self-reflection to assess how the licensee's social position can influence their relationship with patients in their communities. So again, recognizing sort of our privilege and social location compared to patients. And then this also applies, I'll try really hard to make sure that I use patients and students, but again, patients is my population. So there may be, if I forget to use it, we can apply this to students as well. Skills to enable healthcare professionals to care effectively for patients from diverse cultures, groups, and communities. And then making sure that we can apply health equity concepts into our practice. And then since I am doing this, not just for athletic trainers and healthcare providers, there are professional education or standards also for the teaching side of things. So this is from the Professional Educator Standards Board in Washington that also has standards relating to teaching. So again, in the areas of cultural competency, diversity, equity, and inclusion, again, that sort of intentional practice and learning about different things that can affect those that we teach and those that we serve as healthcare providers. So today, hopefully we're going to identify some barriers and be able to articulate and identify what those barriers are for patients or students living in poverty when accessing healthcare services or obviously educational services as well. Hopefully we have some a chance to enhance your empathy. We usually develop empathy through feeling. So the simulation that we'll do usually causes you to elicit some feelings. So hopefully that makes it a little bit more of a deeper understanding of that. And then we'll discuss maybe some possible strategies to implement when dealing with patients or students within this kind of poverty area. So when we think about the implicit bias, again, there are the Harvard implicit bias tests. There's lots of items you can take it on ethnicity. There's gender, age, weight, religion. I'm always surprised by my results on the one that's based on gender. So again, females and males in leadership positions and kind of what that looks like and stuff. There's not a specific test actually related to socioeconomic status. But there's a lot of related concepts with the other implicit bias tests that you can take that you can use to maybe help inform your thoughts on that subject. Again, we'll talk about some statistics and facts. A lot of the times those are generalizations, which serve as a great starting point, but we want to make sure that that doesn't preclude us from factoring in individual characteristics. And so really thinking through that. For everybody on the call that's a healthcare professional, this is the idea of patient-centered care, right? We're going to take each patient for where they're at and realizing that they're unique and there's a unique set of circumstances that create in each individual person, and we don't want to label or stereotype or approach every person the exact same way. So we'll talk about some definitions. I think cultural competence, I feel like the word competence is kind of falling out of favor because we really don't become competent in somebody else's culture. But it's still a definition that exists in there, and it's a process in which healthcare providers or educational professionals become involved and appreciate different cultural differences. We want to provide care or education that's culturally sensitive, culturally appropriate, making sure we're meeting the complex cultural bounds, health and education needs of a given person, community, or family. And then really figuring out how to work respectfully and effectively with populations and environments that are diverse. So we've talked a lot about, through class about the idea of culturally, relevant care. Not everybody approaches healthcare the same way or values it the same. So making sure that we work within that. Not everybody's access is the same. And so we need to think through how access determines that. And then a lot of these concepts can be applied, obviously, to access of education. And again, trying to figure out how to meet people kind of where they're at and with whatever, limitations they might have based off of circumstances going on outside of healthcare or education. So I think a newer term that I think maybe is a little bit more appropriate is developing cultural humility or a cultural skill. Humility is often seen as sort of an alternative approach. So again, this sort of gets at the idea that it's a dynamic and lifelong process of focusing on reflection and personal critique about how we are interacting with patients different than us or students. The humility is, again, the idea of, how we become engaged in the process of developing that cultural humility and how we approach that. The lens of cultural desire dictates an understanding of social inequities and how they affect individuals. We have to understand the different things that affect individuals before we can really figure out how to empathetically approach that process. And then skill is really the ability to conduct a cultural assessment so we can make sure that we're collecting that cultural data. I think there's a fine line that we've talked about as far as, it's not their job to provide the education, but it is our job to ask the questions. And so we have to make sure that we're asking questions and not making assumptions. And so, a lot of times, again, if we listen more than we talk, patients will tell us or students will tell us what they need. And so making sure that we're really listening and paying attention to that as we're exploring this process. So this is really going to be health focused, or this particular slide. So I couldn't figure out how to make this more education focused, this particular slide, but there's a lot about health disparities and health equity. Disparities are going to include differences that occur by gender, race, ethnicity, education, income, disability, whether you're in a rural or urban area, and sexual orientation. And there's a lot that we can continue to learn, within this particular area. So I really encourage you, most of you are going to need continuing education credits and units here shortly, and really look for the opportunities to learn about care for patients that are maybe different than what you see every day. While it's obviously important, to be up to date on the patients that you see every day, we never know who's going to walk in. And so making sure that we're expanding that. I think California right now is offering a 1 credit webinar. I think it's next week, that's specifically on transgendered athlete care. And right now that's such a hot topic item. And I think there's a lot of misinformation out there, especially within social media, as to what that looks like. And so, learning from actual healthcare providers that work with those populations. I think Stanford has a really good area that had LGBTQ plus healthcare needs and kind of what that looks like and how to approach that care in a way that makes them feel safe and heard. And so taking opportunities to continue to learn, again, about patients that we might be seeing and creating that safe space for them. Again, with health disparities, there's a difference in the incidence of prevalence and mortality and burden of diseases and other adverse health conditions that exist around specific population groups. And a lot of times those are deeply rooted systemic issues that exist. And so the only way that we're going to undo those is to continue to kind of not so much fight against them, but we don't want to fall into those traps. There's much more mortality for Black women giving birth than white women giving birth. And that exists because there's a perception that, Black women can handle pain more than white women. But again, that comes from systemically that they had to give birth without pain medications because that was not an option for them. So it's not that they can handle more pain. They just didn't have the option to receive pain medication. And so this perception just is sort of systemically now it is within healthcare, and we need to figure out how to work around that. I'd also be really careful about labeling patients. When you interact with a patient and you're entering notes, and some of you may realize this when you're entering stuff into Epic, right? There's a place where you can add things about characteristics or your impressions of how interactions went. And we want to be really careful about how we describe the demeanor of the patient that we're doing. If we label them in an Epic note as aggressive, that's a tag that's going to stay there forever and it's never going to leave. And it can now impede somebody else's preconceived bias for interacting with that patient the next time, right? Because they now view this patient as aggressive, having no idea the context for that or how that got labeled. So just being really mindful, again, of how we enter that information. And I'm assuming that that's the same within the education realm, right? If you are teaching second grade and you label a student a certain way to the third grade teachers, then that perception sort of follows that student. And whether that is a fair assumption or not is important to consider. Health and inequalities are assumed to be socioeconomic differences unless otherwise specified. So a lot of times this is our access to healthcare type idea. You know, this is going to be really important, especially for those of you that want to be in the high school setting. You guys have all gotten very used to WSU athletics, and we can send anybody for any healthcare MRI, X-ray, test specialist pretty easily, right? And there's not a lot of pushback on where we do. Those of you that had your high school rotation, if you did it at, Potlatch or something like that, there's a big difference, right, in access to healthcare. And it's not easy to just, send them for an X-ray or something like that if that's not something that their family can support or take. Explanations for group health disparities often focus on structural factors. Again, differences in socioeconomic status and access to healthcare are huge. A lot of you are under the age of 26, so there's a chance you're on parent health insurance. Not all of you have that option or still are able to do that. I can think of one person on this call that had to do some dental care that was nowhere convenient to the area because, again, that access wasn't, what they could access wasn't close, right? And so there was a whole travel thing involved that really had a huge impact on class time, ability to do those things. And we got to make sure we take those things into account when we're thinking about that stuff. So that's a little bit about health disparities and health equity. And I'm assuming, again, a lot of this can be applied to the education settings as well. So some underlying values and principles that sort of guide, especially within healthcare. Most healthcare have, ethics statements of how we're going to engage with our patients in the world. Usually it's all people should be valued equally. It's interesting with a lot of things that are happening politically in certain states. Healthcare providers may or may not have the option to practice some of these things based off of state mandates. And that may be attractive to them because they don't want to have to do certain things, or that can be very unattractive because that is, it's limiting their ability to be the healthcare providers that they wanted to be. Health and education has a particular value for individuals. Was anybody on this call in charge of the healthcare table at the recent big poverty simulation? Or what did you guys notice about the healthcare table? Was it visited or populated very often?
No, I remember Colby working that, and yeah, nobody really went to him. A couple people had like medical emergencies that ended up happening.
Yeah, so not a lot of people access the healthcare table. And why weren't they at the healthcare table?
Expensive. From what I remember, Colby went around and started trying to offer health insurance because a lot of people needed health insurance, but they were like, I don't have money. Yep. And then, yeah.
Yeah, so the issue becomes access to it and then money, right? I think, Erica, you hit the big reason why that table doesn't get used. The other big reason is they're too busy just trying to get to work and get to childcare and get to their kid to school and, and pay the rent and not have their stuff taken away, or they're going to the pawn shop, right? Like, again, in that simulation, they don't have time to go get their diabetic medication or to do their routine, care during pregnancy. And so again, it's not maybe that it has less value for them, but it can't rise to the top, right? They have to prioritize other values. And it's really important that as healthcare providers, we don't judge them for that. Okay, we're in the business because we think healthcare is important and we've put a certain value on it. It may not be that they don't value it the same way we do. It can't fit into their life, right? They don't have time to take 5 buses to get to a doctor's appointment. I think this is especially important when we think about mental health, right? People don't have time out of their day to take an hour off of work to do this if that's really important, that they need to be able to earn that paycheck and they have other people responding on that. So again, realizing that it has particular value, but it also has a particular place of importance within everybody's situation. Again, trying to make sure that we certainly are being non-discriminatory and practicing equality in our patient interactions and education. And then again, health and education is of special importance in society. And I feel like right now this is a huge crux in our country. Everyone's trying to figure out what that importance is. A lot of people put high importance on it, other people don't. Should only certain people have access to it and not others? Is choice important? Is it not important? Right. And so I think these are all discussions that society at large is grappling with right now. And I think it's a little of an unstable landscape right now, which can cause some angst for those of us that are choosing to enter the world of healthcare and education. A lot of times those two things were kind of stable workforces, right? Like we could enter those knowing that there was a certain stability. I feel like right now maybe people are questioning if that same stability exists, because there's a lot of grappling, I think, going on with healthcare. I think important to note here is, remember, health disparities are systemic. They're not usually isolated. Again, they're built into the system. And so the reason they're so hard to move is because we've got to get them out of the system. So they're usually not isolated or exceptional findings. Again, they're built in there. Unfortunately, they're usually systemically linked with social disadvantage. And tend to adversely affect groups who are already disadvantaged socially, putting them at further disadvantage with respect to their health. And we'll talk a little bit about this in some other slides when we talk about people without homes. But again, this kind of has a big, it's a big loop, and it's a big cycle that we kind of get stuck on. And it can get a little frustrating, I think, to try to figure out how to break that cycle. So again, this is a little bit more of a health related example, but again, when we think about high school and collegiate athletics, there's a huge discrepancy in care that exists, right? Just earlier today, I had to do, it was somebody doing a project at another university that was talking about, well, why are concussions still an issue, and why are people not doing it? And it's like, and how do we stop that? And it's like, well, hire athletic trainers to be at your school. Because that's who's going to stop, concussions from going back in. But again, there's high schools that can't afford that. Right now, there's a lot of cuts coming to education, and they're trying to figure out how to educate. And sports are now getting cut from schools. What is it? Is it Central Washington that just cut their rugby, women's rugby? There's another school, small Division III school, that cut all their sports. And so there's a lot of stuff going on right now that did it. Again, those of you that are athletic trainers, we just saw today that now their military is trying to cut athletic trainers out of the military. Kasee, that probably concerns you a little bit, given your internship next year, right? But this is, again, when cuts are being made, we got to make sure that we're showing our value and our worth. Again, if physicians or other practitioners that you refer patient students don't accept Medicaid, which is for students that don't have insurance, if they don't have payment, you may not know where you're going to send them. Being really paying attention to that, thinking about appointment options, and then thinking about the transportation issues and how we're going to get them to that. And that really, again, becomes an inclusivity issue. Social determinants of health. Is this something that ever gets discussed within the education realm, Eric? Have you heard of this before?
I mean, there are a lot of overlaps here.
Okay.
I mean, if you give everything you're saying resonates with
Okay.
the families and stuff in education. But I mean, you see a lot of schools that will partner with community health organizations, that are under grants. And so those federal grants disappear, and then, they lose like dental care or, the monthly whatever visits. So it's similar. I'm just trying to dig into how you guys are seeing it.
Okay.
Mm-hmm.
Okay. So again, a lot of you have seen the social determinants of health. This is really the idea of, the circumstances of how people live, work, and grow that's going to shape their daily life. And so taking all of these things into account. And again, these social determinants often cause negative health outcomes, which is going to affect, mortality, morbidity, life expectancy, health status, and different limitations. So quickly, just going around the circle, remembering, economic stability. There's a lot of job, I would say, insecurity right now. And so thinking about how that might impact different people that were around. I feel like initially it was sort of slow moving, but now I feel like more of our area is starting to get affected by some of the changes that are happening. That food and housing insecurity, again, poverty and what that looks like, I think to Eric's point, right, as federal funding changes or is withheld, that has huge impacts on a lot of these programs that we might have used as resources previously in order to help individuals or families in these situations. Obviously, education, where their levels at. So high school graduation, enrollment in higher education, is that an option for them? Is that something that will be a possibility for them or not? And again, language literacy. I think, I don't know if this was accurate or not, because you can't really believe anything that you see on social media right now, but I know something was talking, it was like the weather alerts, and they were getting rid of having weather alerts in any language other than English. Well, that is obviously going to have huge impact, right? Because not everybody in our country speaks English, and we need to make sure that we're making weather alerts accessible to all. So really thinking through some of those things and the impact that that can have, and how can we hopefully kind of continue to either work around that or find other options. Healthcare, obviously, access and health literacy. How much do they understand about health literacy? And then where is their trust in the healthcare system? I think the COVID pandemic really highlighted that maybe there's a large group of society that does not trust vaccines. Prior to that, maybe it was a small subset that we heard a little bit of rumblings about, and now I feel like it's gotten much more widespread, and we hear more about, not wanting vaccines against some of the childhood diseases that exist, as along with continuing to not want COVID or flu shots and that kind of stuff. Social and community, obviously, I think the civic participation, that's really interesting right now, that at least it appears that this is an increasing area right now as people are starting to take issue one way or another with kind of where things are at. Discrimination, incarceration, social cohesion, all of those are going to affect that social. And then again, neighborhood built environments. We're going to talk about food deserts here in a minute, but what is the access to healthy foods? I think as food pantries at different times might struggle to have food for people, what are their other options beyond that? Crime and violence, environmental conditions, and then again, quality of housing or lack of housing can also impact kind of their interaction with health.
Well, Kasee, I'd also like to add to that, like you mentioned a lot, but with COVID, after COVID, there was a bunch of federal funding for schools. That funding is ending this year. So a lot of programs are being cut, teachers are being cut out. And then you're looking at limited language resource opportunities for kids. That's what I was looking at right now. Like that, a lot of the kids are, they're the language brokers for their family. So then they're not learning language and literacy skills that can help with that. You're looking at lack of classes, and extracurricular opportunities for them to learn about these other things. Standardized curriculum that prioritizes certain things over others. And so it's like this is deeply embedded into K-12. Absolutely.
Yeah, and there's just so many areas that are being touched right now, and I think again it can make us, it makes us feel unstable, but the hope is that we can be stable for our patients or the students that we're working with and provide that. I know we've talked before, some of you had athletic trainers at your high school that you had good relationships with, and they sort of acted as a stability for you, right? And they had options. Maybe they had food within the athletic training room that was open to anybody. And so especially individuals that maybe didn't have food lunch options were able, to do that. I can remember with, my son, when he played high school sports, especially, the football team was large, and it was like all the parents would get together and make a similar lunch for everybody on the bus as they were going there to make sure that everybody had access, to food, because that isn't an option. I can remember, feel like I've tried hard, as a parent to make sure my kids knew that. And I remember my daughter had a friend, and we were going to go up to, I think, one of Caden's football games, and she'd invited the friend, but we were going to go out to eat. And Callie was like, I don't think she can come because she can't, like, she doesn't have money for dinner. And that just concept did not land with my daughter, because that wasn't something that we've had worry about. And so explaining that, that not everybody gets to eat out, that's a luxury that, we're able to do by, how circumstance and how we've moved through life. And so, again, just providing those opportunities and making sure that we're not, singling out and making kids do that. I know I can think of one student that did athletic training, and then she did the master's in teaching at WSU, and now she's a teacher. And when she was doing her student teaching down in Clarkston, I think Clarkston's part of a triangle where students move between 3 different schools, and they basically are out of school until all those resources run out, and then they move to the next school so that they can get a new round of resources. And so they tend to be a little bit more transitory as they're kind of moving through that process. And she's like, I really want to be able, this kid doesn't have a coat and I want to be able to provide it. But if I provide him a coat, I've got 6 more kids that also don't have coats. Right. And so again, how can we connect them with, resources to help all of them, and maybe not, certain ones, but again, it can be tricky, but it's definitely something that we have to continue to think about. Okay. So, homelessness is now not the correct term. We want to experiencing life without homes correctly, or some sort of idea that it's a transitionary or transitory thing, hopefully. But addiction is a big reason. So 2/3 of the people without homes said addiction was a main reason for their situation. And so again, from the healthcare standpoint, right, we've talked about a lot of times we don't think about the opioid epidemic, but again, that might start with us, right? Because we had patients who had to have a surgery, they got prescribed pain meds, and so we're on that front end. So how can we work with them to hopefully prevent it from becoming something that they become addicted to? More than 90% of women without homes are victims of severe physical or sexual abuse, and so escaping is the cause for their lack of home, because they're trying to escape that situation. So again, being aware of that statistic. And then individuals with disabling conditions. So again, long-term diabetes that's not being managed correctly, Alzheimer's, and then mental health are big reasons why we may have individuals that face long or repeated episodes without a home. So again, being mindful of, again, from this, since the focus of this is really the poverty side of things, that, we have individuals without homes. There's plenty of stories that make it to the news of high school students that didn't have a home and have been living out of their car, or various situations like that. And I think for all the ones that make it into the media, there's a lot that don't, and that we're not aware of. And so I know we've had students within the AT program across the years that experienced life without a home at different points. And so being really mindful of what impact that may have on individuals. So some more facts about homelessness. There's about 500,000 in the US. There's a lot of causes for that, but poverty is a big one. And the poverty is highly linked between healthcare costs and bankruptcy. So again, thinking about healthcare and what those costs look like, a lot of you maybe haven't, some of you have had to experience your own healthcare costs, and they're a little ridiculous, right? With how much things cost at sometimes. I have a friend who is fighting the insurance company because they had to have radiation for cancer, and for whatever horrible reason, it's getting denied coverage. And, 5 radiation treatments was $55,000. Most people don't have $55,000 sitting around in order to cover life-saving radiation treatment. It's been probably 15 years ago now. My husband, we had an unexpected, I say we because it very much affected me, broken leg situation. A lot of you have heard about. And, between the broken leg and the surgery to, correct it, the hospital stay, the physical therapy, the surgeries we had after the fact because we developed drop foot and had to have screws removed and all that kind of stuff, an accidental breaking of the leg during a recreational softball game was a $52,000, insurance cost. These are huge costs that a lot of us we're not prepared for. Getting a helicopter off the ground is $30,000. Katie, you've probably heard Katie's story about the basketball player that had to get life flighted from the Bahamas to Miami. That's only 30 miles, and it was what, $32,000, and that was almost 20 years ago when that cost happened. So healthcare is a big reason where families end up being in trouble and bankrupt, which can end up resulting in without a home. And then again, addiction and mental health, we already mentioned. There's a higher propensity for, disabilities, ethnicity, LGBTQIA+ youth, and then veterans to also end up without homes due to various reasons. Interestingly, a lot of times people are like, well, they just need to get a job. And that tends to be a sort of flippant response. But a lot of individuals do have part-time or full-time jobs. It's not enough to keep them in an apartment. You can get a $20 an hour job, which sounds great until you realize how much you actually take home from that job and how much apartments cost in Pullman, right? So most of you are experiencing this because you're at the end of your educational career and have probably been experiencing a lack of funds for a number of years. Unhoused individuals have a higher rate of illness and usually die around 12 years earlier than the general population. So again, this does have an effect on life expectancy. Again, it's very stigmatized in the US and is becoming criminalized in a lot of cities. So it's now, if you don't have a home and you're trying to exist somewhere, it can actually be criminal. And there's some recent rulings from the Constitution that says the Constitution doesn't protect individuals against cruel and unusual punishment for living in areas that they're not authorized to live in. So again, not great situations when they're faced with this, and now it's considered criminal. Okay, what do you guys remember about food deserts? We had 2 different books that talked about food deserts.
Wasn't the food desserts kind of talking about like people's uh like living situations and like how people that live in a better community usually get better stuff while people living in a worser community or low income don't get what they kind of deserve, if that makes sense?
Yep. It does have an access component to it. Anybody else have anything they want to add?
Is this related to the concept of like when you go to a grocery store, like the healthier foods are on the perimeters, but they're more expensive, like the fresh meats and vegetables. As you get in towards the center of the store, it's the cheaper, more like high caloric, unhealthy foods. And that's where folks tend to have to buy those, that are on a limited budget.
Mm-hmm. Yep, that could be part of it. So the 2 different books that we had talked about in class. So we had The Deepest Well, which was the one that was on ACEs, Adverse Childhood Events. And that was by the Nadine Burke Harris, who is the physician in the inner city San Francisco area. And so typically, so it can be the idea of kind of what Eric talked about with individual grocery stores, but it also is the idea that typically fresh food is not found in super urban areas. So lower income areas don't tend to have access to the healthier, fresher food because we don't have big grocery stores in the middle of these sort of lower area urban spots. What they tend to have is more convenience stores. And the convenience stores are going to be stocked with the stuff that, again, can be on the shelf for a long period of time. And so it's going to be less healthy. And then Michael Bennett talked about it in the What Makes White People Uncomfortable book, because he talked about it from the standpoint of he did a lot of work trying to do that because, again, this disproportionately affects certain ethnicities that are going to be found more in these low-income socioeconomic neighborhoods from having access to this, and having less access to food obviously has huge health implications. And so food deserts very much are tied into this entire kind of idea of poverty and health equity discussion because of the fact that, eating the fresh fruits and the meats and those sorts of stuff obviously have been shown to have better nutrition versus the more convenient things that, sometimes taste better, but are not as good. So food deserts, urban area in which it's difficult to buy affordable or good quality fresh food. It gets classified as a food desert if you have, if the population is not located within 10 miles of a larger food retailer. And so again, typically we tend to think of these as being more like the inner city things, but like I also think about this in like the state of Montana, right? If you've ever driven on I-90 through the state of Montana, how many large cities do you drive through as you are driving across the state of Montana? There's a lot of little teeny towns, right? But they're not going to have a huge grocery store. So it's like when you're going into Montana, realistically, until you hit Missoula, there's not a lot of options, right? I think the next big Walmart was in Kellogg, Idaho. So that's obviously, I would also consider that to be a food desert potentially, right? Because they're just not, they can't go down and get fresh food every week because they may be having to drive 50, 75 miles in order to find that food. So I think we can think of food deserts as not only inner city, but also rural, right? It can also have an impact. 20% of the rural areas, again, are classified as food deserts. So that's a lot of people that are living out there. I think even if we think about how far some of our communities have to drive into Pullman or Moscow in order to get kind of the larger food retailer. So again, not having access to high quality food can lead to obesity, nutritional deficiencies, diabetes, heart disease, mental health disorders, and a lot of chronic diseases. And again, these food deserts disproportionately affect different ethnicities and socioeconomic statuses. So again, this is kind of that idea of they're already maybe limited because of other things, and now we're going to heap on the fact that also they have less access to fresh food. Okay. Many of you have already done this before, but this was way back when you were pre-first years or first years, I think, when you had to do this poverty sim. So please, you're going to click this QR code, click through it. You don't need to make any donations or anything. You're going to play it. And this is where it's kind of like choose your own adventure, right? You're going to have to make choices. The goal is to make it to the end of the month and still have money. So usually this is a 10 to 15 minute thing to do. Go ahead and do your raised hand feature that stays up for a little bit once you have finished, and then I'll wait till a lot of people have finished before we'll come back and do some discussion questions. And you can turn your video off if you want to while you're filling it out. All right, Eric, were you able to do it too? I know Julian isn't going to be able to.
Yeah, I went through a couple different occupations.
So you did it more than once?
Oh yeah. I made
Alright.
it to day 9 on my first one, so.
Yeah. Okay. People can come back on camera and you can lower your hand if you want. Okay, for any of the students that have done this before, did you notice anything different this time?
I feel like it was a lot less. I feel like it was more complicated when we were pre-first years or first years.
Okay. How so?
Like, I feel like the questions were easier and that it was like kind of easier to get through to the end of the month. But like, I remember when I did it like pre-first year, I just kept failing, getting
Yep.
like job strikes and stuff.
Okay. Well, you may have lived more life too, right? That maybe changed your decisions. Did you feel like you made different decisions than before?
Maybe that could have been it. Now I
Yeah.
think about it.
Okay. Okay. Anybody else have thoughts on it being different?
I think I agree with Erica that like when I did it first, I was what, like 19, 20 years old, and now being like older and having gone through like these last few years of college as what I feel is like that like poor college student, it was so much easier to be like, oh, well, grandma doesn't get her medication because I need to eat and pay rent. Like it's so much easier now to make those decisions when you've like gone through it. And but also like makes you realize like, oh, you know, a lot of other people have even more decisions to make and kids that they have to consider. And like I could just, you know, click a button that says, you know, pay off my like credit card debt, but this like imagine actually having to like give up that much money, you know, every month. Like that would suck.
Yep. Good. Others?
I like the choices that were like moral choices versus like economic choices, right? So do you help your mom with $100 for her meds versus do you pay the $15 for your kid to whatever it was, join a team or go to the museum or get ice cream? Like there are certain things it's like you can see where it's like no, and then you can have that conversation versus you're stuck, right? Or the friend, the one I was in, like the friend paid $200 a month but was up all night partying and doing that, and then you're in this, well, do I get the $200 or do I, kick my friend out? So that was a cool aspect of it. Like those real life decisions where it's like, no, I gotta pay the minimum balance or I'm done on my credit card. Or, do I help my mom or kick my friend out? So that was cool,
Yep. Okay.
which is that stuff happens all
Yep.
the time.
I just feel like I took this and it's easy to sit on a moral and ethical high ground when you have money to back it up, right? Like,
Right.
of course, I would never hit and run somebody. But when this gives me the option of I need to pay $400 or do a hit and run, and my bank account only has $210, I don't have an option of whether or not I want to be a good person that would not do a hit and run, right? Like that, there's no choice.
Well, and then it should have been like, all right, let's say you do have insurance. Okay, so that hit and run is bad, but if you do own up to it, then your premiums go up, and that's going to hit you on the backside every month.
Yep. And I defaulted on my credit card because, yeah, I believe that paying your credit card bill is probably a good idea, but I didn't have the minimum payment to pay my credit card bill. So did I survive the month with, $129 debt? Yes. Did I default on my student loans and my credit card debt? Did my kid not get to eat ice cream or get to go to the birthday party? And I'm putting up with the person who's living on my couch that's making my life awful because I need his $200. Yep.
Yep.
So again, you know, I think going through something is, and I think it was good that you guys had some perspective on maybe how things changed from when you were 19, 20-year-old filling this out for the first time versus most of you have now, again, to use the term, you've lived a poor college student experience and you understand some of those choices that you have to make. And, you know, they were really hard to make when you're 19, but you've kind of been having to live with making those decisions lately. And not that it makes them easier, but I think in this mock thing that can almost feel like a game, it does become easier, right, to make those decisions.
Yeah, I
So-
mean, it was really simplified, but it does give like some insight into it. Something that I've run into with a lot of folks, you know, in the community where I'm involved with, like there's an opportunity for like a job interview to get a better job, but to do that, it's at noon and you can't take that time off to go do that job interview because if you do, then you're fired from that and then you might, so it's a spiral, right? How do you balance those obligations and the security of what you have versus what you could have or nothing?
Yep. And most of you got to the point where you had to make grocery decisions, right, on what you were going to buy. And how many people were buying the really good stuff that cost lots of money versus the ramen.
The
For you.
ramen and the sauce, yeah, the sauce and the hot dogs. Mhm.
I'm always like, they might have to update some of their prices, especially given now, like, I don't think eggs are going to cost me $2 for a dozen.
Yeah,
But that's
egg,
okay. Nice
that made
thought.
me laugh. Eggs are $2.
Yeah.
That's why I have chickens.
Yeah. Okay, so again, this is the participation, so everybody needs to discuss. Thank you for those who've brought it up before, but what other things did you learn about living in poverty, either by playing this game or what you've learned by living through the college experience?
Something I've learned is that, like, when you know about the resources, it's really easy to get those resources. Like, applying for, like, food stamps or, like, applying for Medicaid or, like, just knowing how to do those and knowing about them is makes everything easier. So,
Okay, and
like,
how did you learn about those things?
class.
Okay, that's good.
Well, this simulation remind me of my early days as an international student. I lived on a loaf of bread for a long time, just bread and peanut butter. And yeah, and I signed up for the school. Our school has a really good medical school. So I signed up for test subject just because in that way I can get free stuff.
Yep.
And,
Free stuff.
for international students, we don't have much choice for health insurance option. And we can apply for like scholarship. We're limited with the resources that we can get. And so it's pretty much rely on friends. I remember I eat a lot of beans. and even ramen is considered expensive. So that's why I go to sometimes down the street, I don't have car for a long time. So I have to walk and to go to do grocery. And the grocery has those kind of toward the expiration date. They have like the little section like discounted bread or like a 2 days old bread. And those are the places that I would go. So I think from time to time I see that happening in our town, like Safeway. They have those discounted place. And it's just out of habit, I will just go shop over there first versus, even though I think I have a salary now that can really support my family, but it's just a really an old habit that I have since graduate studies. So.
Yeah, no, all good points. And I think you bring up a good thing, a lot of us have worked with international students. Either we have classmates that are, or are a lot of our athletes here at WSU, right? Our international students. And that is a whole nother set, of potential challenges. I know one thing I hadn't even thought about for one of our students who is international, they get hit with the insurance, right, that they have to buy in order to be a student at WSU. And usually they wait later to pay for it. But right now, with the exchange rate, what it is between where they're from and paying it is greatly fluctuating. And so it's this gamble of figuring out exactly when to pay it when it's going to be the least. And not to speak for Katie, but she's getting ready to go travel to Europe. And it was like she did it on one day and the exchange rate made it so that she only had to pay $13. And then I think your mom was at 21, 26, something like that, right? And it had a huge different cost just because of the exchange rate. Whereas normally that's pretty stable. And right now that's fluctuating at least daily, if not hourly. And so again, the impact that can have on our international students. And then again, obviously we need to think about the larger impact, and some of them are afraid that they might not be able to stay here, or if they do go home to see their family, they're not going to get back, be able to be back into the country. And so there's a whole new kind of thing to think about that. And again, how that access, and then, a lot of you have again worked with athletes, and there's a huge language barrier, right? How do we communicate with individuals that don't do that and don't have them rely on other teammates or other individuals? And so we just talked about this in class last week with the second years in psychosocial. How do we do that? Medical interpreters, obviously there's a lot of Google, and there's those of you that are in the football ops, right? We have the translator that is over there that really helps with that kind of stuff, but all good points. So how does going through today and kind of experiencing that translate to your role as either a healthcare professional or an educator?
Well, Kasee, I also wanted to mention, a lot of your students, just like ours, that will be teachers, and yours will work in schools and stuff. And, it's like we'll be working with students who are, selling drugs or in alternative economic situations, and to understand that that's not like a life goal. And, it for a kid that sees, okay, well, I can work at a minimum wage job and help my family who might or might not have jobs, and work 40 hours a week versus, slinging a bag of drugs and making that whole month in 1 or 2. So it's just that perspective towards the kids that we're working with, and knowing that there are depths to that, but not automatically judging, and understanding that it's about survival. You can get into Maslow's hierarchy of needs here, and it's like there's an efficiency for doing things to support your family that, step outside of the moral obligation of backing into somebody and leaving versus, hey, I can pay for that. And so but being mentors and working with kids on decision making and opportunities and information like you're talking about. And I have very good friends that work at, like, especially alternative high schools, where those students are on the end of being eligible for graduating, and they're involved in all that. And it's like, instead of judging them for what they're doing, it's like why that's happening, and how we can mentor students in that situation and engage families and provide information like these resources you're talking about. And that's a big thing I go over with my students is, you're going to encounter this situation. It doesn't mean they're bad people. They're surviving. And, when you look at these, I love these kind of simulations, because it shows you it's dire, and we're all taking this from a moral high ground of, okay, what would I do, versus, man, how do you make it happen for the family? Like we all shop for ourselves. What happens when you got 5, 6, 7, 8 people living in the place that don't have credit, that don't, maybe they've been incarcerated, so they're having problems getting jobs. And so it's a very complex situation that we're working with, not just paying bills. I mean, it's socially, like, how do we get students out of that track and show them a way that is promising so they, don't have to be involved, in those types of situations. And then it gets into gangs, and gangs are like family and support and solidarity. And so it's really complex when you get into the actual context. Is that's something I appreciated what you said at the beginning about, we don't know what somebody's context is. We're not in that. We can understand the factors involved, but it's about survival, and working with them on these resources and different pathways is super important. So that's what I've appreciated.
Yeah, I remember we had a candidate that was on campus interviewing for a position, and he had previous teaching experience at an inner city high school, alternative high school. And he was saying, he kind of ran into some issues because he would have kids in his class, and he's like, they had an inability to get sleep at home because they didn't either have a home or they didn't have a safe place where sleeping was safe. And he's like, he would get kind of some pushback from his administrators because he would let him take a 35, 40-minute nap in class. And, he's like, I had to meet them where they were at. They weren't going to stay awake through whatever I was trying to teach them. At least I could offer them a safe place to try to recover. And I thought I'd get more out of them by giving them that, 30, 40 minutes to try to get some sleep in an area that they actually felt safe, and then do learning. Because if you're not having your basic needs of, sleep and food, learning isn't really, again, going to be that hierarchy. And so really, again, I think, meeting people where they're at, again, athletic training, I think, is a unique profession. There are times where you will become surrogate family members for, some of the patients that you're dealing with, which, again, we can talk about all the, interesting lines that creates and that kind of stuff, but they may not have anybody else that is that stable figure, or, you might be the only person, maybe your facility, you can only really, because again, we don't make a ton of money and all you can provide is bread and peanut butter, but that could be something that, is really important to that person, and again, provides them something that they need so that they can actually participate in things. I think the great thing that you've gotten hopefully out of Katie's class, with the special topics is, we really tried to design that class so you guys are aware of all the resources that now exist, right? You know how to access community resources, how to find them, and then hopefully how to navigate it. So I think, Erica, you mentioned, you know how to do some of those things because we taught you how to do them, but now you need to go out and teach others how to do that.
Well,
be able to do that.
something else that comes to mind, just in, and I come from a, white privileged background, but the folks, like, I played sports through high school and college. Like, I remember my athletic trainers, like, because those are folks you spend a lot of time with before and after and all that. I think it would be, beneficial to work with athletic trainers to also engage with the teachers. I mean, I guess that's in college, that's not as tangible, but like in high school, man, if you have athletic trainers that are also working with the teachers, and you got students in difficult situations, and here's what I'm seeing, and make that collaboration more fluid, and how can we support the student? And because, like, the trainers are there to heal. Like, very rarely do you see athletes like hate trainer. Well, I guess I haven't experienced that, but because it's about healing. And so making a strong connection between an athletic trainer and the teachers, and see what's really going on, and maybe you shed some light for the teachers who have a perspective of a student that's potentially negative. and say, no, it's a really good kid, and this is how can we work together to, you know, support the student. I think that's kind of a missing link that at least I don't know, I haven't experienced that, but that would be really cool, is work with students in your program to be able to better connect with teachers and build that relationship so that there's more of a wraparound, you know, support system.
All right, as well as we kind of wrap things up, we have a little bit more, but what's one thing that you're going to take away from this experience if you're willing to share?
I think for me it was just like remembering not to assume people are coming from either like wealthy or like even a comfortable background. Like the example I thought of is like a lot of our athletes are going to like break for summer, and like you kind of assume that they're going back to a nice household, but not all of them might be. So just not really assuming that a summertime would be a good time for some of the athletes here.
No, that's a great point, Eden.
I think this experience always reminds me, like, and also the spent thing that we just did, like just how much our values come into play. And again, just recognizing like those are my values, they may not match somebody else's values and how I spend money or, you know, how I do things. So I think, you know, sometimes even just asking the questions, do you have funds to do this? Or, you know, do you have even resources or the ability to get there? Just asking those basic questions, I think can be really helpful.
Similar to Aiden, I was thinking how like season changes can impact athletes. Like when we're not in season, they're not getting as many meals and like not guaranteed a travel meal every weekend. So less resources there. But then also like when we're in season and they're super busy, there's less opportunities for them to work and to make some kind of income as well.
Yeah. Good points, Kasee.
I just think about, like, I've heard a couple of my athletes who like, not a diss on football, but like they don't get every meal at Grade Up or anything like that, and so they'll like talk about how on weekends they have who on weekends they like utilize a donut deal, and then so Sunday all they have is like 2 liters of Coke and 12 donuts, and it's like, well, you're not properly fueling yourself, but also at the same time, like that's the only thing he can afford or they can afford.
Yep. No, good point.
Kind of going off what Erica said, like some of the athletes that just don't get on scholarship either, and they're still competing. Like I know a couple athletes of mine that are on the team and they're doing really well, but they're not on scholarship. And so without that, they have to go out and find other means necessary, like DoorDash.
Mm-hmm. Okay. So I'm going to skip through this because most of this was probably your guys' comments. But again, some different student reflections from when we've done this over the years with the poverty simulation. Similar to what you guys talked about, again, you know, being aware of other financial and life situations and that they may look different than ours. And again, we're going to have a wide range of people, and our job is to figure out how to provide care to them in a way that's going to be meaningful and impactful for them. Again, trying to have an open mind and understanding that we don't know what's going on behind closed doors. You know, we don't know what their safety looks like, or, you know, if they have, you know, a consistent home. And again, just thinking about, you know, how much it can impact you if you've, you know, had some sort of damage to your apartment and suddenly you have to move out while they fix it, right? That can be incredibly disrupting to sort of normal function. So again, thinking about those sorts of things. You know, and again, you know, you guys, it's a year removed since you read the ACEs book, but again, remembering those adverse childhood events, right, can really, again, everyone's shaped by their life experiences, and so, you know, different things impact people differently. But, you know, I think Aiden, your point about like, you know, we don't know what people are going home to in the summer, and I imagine, again, this is very similar to from what I remember with the school district, right? They get free meals while they're in school, but are they going to get meals outside of that? What happens on the weekends? What happens in the summer? And I know, at least in Pullman, there's a lot of signs up, right, to show that, over the summer, like they can come and pick up food to be able to do that, which is great. Do they have a way to actually pick up that food during the time that the food is offered, right? Because we got to think through all those things. It's not enough just to say that, well, we're offering free food, but is it actually accessible to them and in a manner that they can, get that food, and kind of what that looks like. So again, really working with, a variety of people, and to Eric's point, working with the teachers, the athletic directors, the coaches, and making sure that, hopefully you can have a similar response, and maybe coordinated effort, in that particular, area. So again, how do we do this and take all the stuff that we've kind of talked about and you guys have learned throughout, the entire time that you've been in the program. But, again, I think asking the patient what illness or injury means to them. It's kind of like sometimes I think, like it's great that we have a vet school here and we could take our animal to the vet school, but they have all kinds of fancy, awesome things. And so they're going to try to do everything they can to save your animal. You may not have the finances to do everything that they want to do to your animal, right? I don't know if you guys had the option on the placement, right? But like, as somebody who has spent thousands and thousands of dollars on an animal in the placement thing, when it was like my dog either needs $800 for their whatever their injury was or $50 to put them down, I don't want to be somebody who would put my dog down, but I don't have $800 in my bank account. Like that's not even an option, right? So I'm now going to have to make that decision. And then again, also not making the judgment, quickly on animals. I think a lot of times people are like, well, if you can't afford to feed yourself, like, why do you have an animal? But think of what animals provide for you and for individuals. That may be the only person that they really have or view as a support in their life. And that's an unfair choice. So again, not making judgments on, what they're doing. But again, what does illness injury mean to them and what are they currently doing? Are they at a place where they can do that? Can they do PT? Or are we gonna have to figure out other options for them? Can they afford to get into the doctor? Are they gonna have to wait 6 weeks? Thinking through all of those kinds of things. I think from the education standpoint, this can fit both athletic training and educators. But again, what does education mean to them and what are the barriers that they have to education? Do they have the time and space to engage in education? Or is this just our parents looking at it as a childcare situation and they don't have time to then reinforce, what the education system is doing that. I think a lot of times high schools really focus on the idea of going to higher education and that kind of, but is that something that individual wants or values? And again, realizing that there's lots of options beyond just kind of that college thing. So again, we need to develop sufficient practice with our mental habits. Self-regulation of bias. So again, checking our privilege and making sure we're staying up to date and really thinking through what that looks like. Making sure that we're staying up to date on cultural appropriate care and education so that it becomes automatic. And again, this shouldn't be a have to, it should be a want to, right? We should be wanting to provide our patients or our students with the best that we can, realizing that they may have real limitations that impact that we're not aware of. So that is all I have. If anybody has any final questions or thoughts.
Okay, so I really appreciate the conversation, and it's really neat to have these critical conversations come from different disciplines. And, I'm just super excited that, you were able to take, something from an athletic training type of context and show the bigger application. So it's been awesome, Kasee. So I really appreciate it. And we have this recording, we'll post it so that you can share. I think there's a lot of useful information that those of you who attended and participated, your comments were great. I think it's going to make a big impact on others who watch this recording. So really appreciate that, Kasee.
Eric, you may, just because I run into this issue, so the QR code is one of those ones that's only good for like a week. So I do have the website.
Yeah, you put it on the slide.
Yeah,
So-
like the URL. So just
Yeah.
so that if they access it and it says it doesn't do it, make sure they realize that the website is on there as well.
When I post it, I'll put that URL on there too, because it's super helpful. So
I
thank
never
you.
know how to make them. Katie is my QR code person. I constantly email her and I'm like, can you make me a QR code for this? So thank you, Katie, for making the QR code, but it's only good for a week and then it goes away.
So okay, we'll make sure that it's accessible for others to share and use with their students in other classes as well. So
Okay.
thank you everybody for attending. This is a great way to wrap up the series for this year. Love the conversation and all of your comments. I wish everybody the best, and just from your comments, I know that you're going to do good things. So Kasee, just hang out for a few minutes. Other than that, everybody,
Okay.
thank you for attending.
Thanks, students, for hanging out for one last lecture. I guess you didn't get enough over the previous 4 years.
There's never enough.